Okay, let's do this. All right, Dr. Natty Bansack's back from Clearwater, Florida, and I'm with a good friend of mine, Anthony Roscoe from Roscoe Physiotherapy.
Physio.
Sorry, we're going
Very
international.
international.
Yes, I love it. So again, second episode of the Badass Clinicians podcast.
I'm on the second one.
Yeah, well, the first one was Jamie.
Yeah,
there you go.
Cool. I'm
for
it.
Yeah, so second one. So listen, we know each other for like 2 years now.
Yeah.
Right? We're on the same business coaching group, and I mean, obviously, Anthony's a stud, great business person, business owner, great clinician, and I think I just want to have you on just to kind of talk about your story, where you came from, and just really going back to the basic of how awesome it is to be a PT.
Yeah, for
sure. So yeah, I mean, without further ado, let's get into it, man.
So, as Natty said, I've been a clinic owner now for we're coming up on 5 years.
Nice.
Prior to that, I was a staff PT for 6 years. So I've been in physical therapy for a long time. I don't know how deep you want me to go back into my story of coming into physical therapy.
I want to hear the grind. People need to hear the grind. 6 years.
I have a very good coming into physical therapy story.
Okay.
Because I did not decide that I was going to be a physical therapist until after I graduated with my undergrad.
Okay.
So I finished with my undergraduate in psychology. I distinctly remember graduating, going back and talking to one of the counselors at my college at the time, and I said, I think I want to go in the physical therapy direction, and they kind of laughed at me, and they were like, "Well, you're not going to do that." And I was like, "What do you mean?" And they're like, "Well, people plan for that for like when they're the 10th grade in high school."
Oh my God!
I'm like, well, I don't know.
Maybe
like,
an Asian household, but I don't know.
Right. So I mean, I felt good enough about it that and looking back, I think like it leads into my business life a lot too, where you're kind of a little bit naive to the situation, and there's a lot of people that you talk to, they detract you from making that decision to do that, right? So they're like, oh, you're not going to be able to get into school. It's so hard. It's one of the most competitive graduate programs to get into. Blah blah blah, like all that stuff. So, I actually had to go back. Post back and being a psychology undergraduate, I didn't have chemistry, I didn't have physics, I didn't have anatomy and physiology. I went back and took all that for a year and a half in the process of doing my volunteer hours, getting references, recommendations, that, and then I was able to actually apply for school. I end of the day, I ended up getting into. I applied to 5 schools. I got into 4, and I had a contingency on the last one that if I took exercise physiology, that they would
take you.
Yeah. So then I would have went, 5 for 5. But at that point, I decided to stay at Slippery Rock. Obviously, for financial reasons, which we can also talk about. I think for PTs, deciding on, or future PTs deciding on schools, but that was, I feel like a very wise decision for where I was at in life, and it really helped to set me up to be in a very comfortable position as I transitioned into being a business owner, as well. Graduated from Slippery Rock. I started working an outpatient job. Probably within the first year, I had 3 jobs. I was working outpatient full time, and I was in skilled nursing. I was juggling a couple different places. I was managing a smaller facility, and I literally worked like 60 hours a week. Like,
why 3 jobs? Why do you make that decision?
Like the first thing I wanted to do when I got out of school. So I moved back home in with my parents, and I was like, I'm going to pay off my student loans.
Nice.
So that was like my first goal. That took me about a year and a half, and I was completely debt free.
Wow.
So
that's amazing.
Right. And the cool thing about that was like, so you start like working all this time, and you have this like drastic shift in the amount of money that you're making. Like your finances change completely.
Yeah.
Coming out of school, and then you have paying job, and then you're working all this PRN.
What year was that? When did you graduate?
That was 2011.
So I think the debt's still probably similar.
It's pretty
similar.
Equal,
Nothing crazy.
I mean, you're probably looking like 6% difference now.
Yeah.
At least on a state school like that. Where I was at, but I got accustomed to just saving money and not, getting used to that increase in income.
Yeah.
Right. So like after I paid off all my loans, I was like, well, I really don't need a whole lot to be happy in life. So I just started banking money. So I continued to do that literally for the next 4.5 years.
Still working 60 hours.
Yeah. I mean,
so after you finish,
I can count on one hand the amount of times that I turned down PRN, literally in that 6-year period. Never. I mean, if holidays, like birthdays, anything, like I was just like, and it was funny at the time because I really wasn't like, I didn't really have like a goal in mind. I
Mm-hmm.
wasn't like, oh, I'm going to work all these hours and then I'm going to open a clinic and that stuff. It just kind of was like what I knew. It was who
Mm-hmm.
I was. You know, I was into working. I was into physical therapy. I enjoyed the grind. I'm really big into like working out, weightlifting, and that. I think there's definitely a big correlation there, you know,
Yeah.
with that too. But you know, again, that enabled me to get accustomed to like having a lower key lifestyle,
Mm-hmm.
making more money, and then saving all that money. So when it was time to make that transition into business owner,
Mm-hmm.
it was very, very comfortable for me. It
Yeah.
was self financed. I never had to borrow a dollar. I still haven't, you know,
Mm-hmm.
at this point. And you know, there was a lot of safety,
Mm-hmm.
you know, with that. And I think that's probably like sometimes the hardest part for people when you're making that jump into, you know, opening a clinic or going independently on your own is
Mm-hmm.
like the financial risk, you know, that comes with that, you know. And after I did that, I still work PRN, um, God, probably like 2 years into business,
Wow.
you know. And that again, like it was a contingency for us. We didn't take paychecks for the first, it was like 9 months, I
Mm-hmm.
think, in the business again, like just like accustomed to building up that nest egg for safety and security.
Mm-hmm.
And you know, here we are today. And you know, it started out with my girlfriend at the time, now wife.
Mm-hmm.
When we started out, it was just the two of us in a room.
Mm-hmm.
And I think we have like 11 or, you know, 12 employees now, so
Yeah, you got
it's grown
beautiful clinic. If you guys
tremendously.
want to see a nice Miami-is
Definitely
clinic,
Miami
definitely
vibe.
check out the clinic. I mean, let's go back to you just working like 3 jobs, man. So
Yeah,
this is probably the best thing to hear because new grads expect to come out and get paid. I mean, where I am, New Jersey, it's
yeah,
like I don't know, 80 to like I don't know, some of them might even ask for 100, whatever it is, traveling
yeah,
PT. But the fact that you did literally the most basic things, like oh yeah, I'm just gonna bust my ass to pay a
yeah.
student loan, dude. You sign up for that student loans. No one's responsible to pay that off for you.
Right,
Like you made that
100%.
commitment, and the fact that you did it. And you're like, yeah, this is my loan. I'm gonna like. I mean, the fact that we have to go over this, that it's your loan, is like if I take on a mortgage, I don't expect other people to pay my fucking
Right.
mortgage.
I had a laugh at one point in time. I remember like there was a post made in one of the Facebook PT groups, and they
Oh
were
my
all
god, those are
complaining
the
about
worst.
right,
Yeah.
all complaining about student loans. And there was a girl that posted in there, and she graduated from the same school that I did
Mm,
1 year after I did. Right,
mm,
so we're like exactly the same on like the debt
yeah.
ratio, like everything is equal. And she's complaining about how much money she's in debt, how unfair it is, how she shouldn't have to pay it back. It's going to take her 30 years. And here's me, like I'm sitting here, I'm debt free,
Yeah.
you know. And it's just like it's a lot of that is like mindset, how you look at the situation,
Mm,
you know. But if you look at yourself as a victim in that situation and say that someone needs to pay this back for me or I shouldn't be responsible for that, I mean, that's probably going to translate into the rest of your life and the decisions that you make too, you
mm,
know. Paying off my student loans, I mean, even if tomorrow they said they were forgiving all student loans, I still would be a huge benefit for me, and how I felt about myself and how that really
mm.
helped to shape who I was and shape my mindset, you know,
Yeah.
moving forward, because it
No,
changes stuff.
I love it, man. I mean, first episode, just talk to Jamie about this. It's just going back to say like, no, that's something you accomplished. No one can ever take that away from you.
Right.
Like, no
Yeah.
one's there. There's no handout,
Yeah.
and that I think that's the best part, right? Like for me, it's like I mean, I find a lot of parallels in what we do. Like I worked to pay for school. I actually took a year off to did all my prereqs and do all that stuff. And
Yeah.
then it was the same thing because like I knew what I was getting into and the juice was worth the squeeze. And even before I started my own practice, I knew that this is a career for me. And
Mm-hmm.
actually, funny story is when I graduated from PT school and I started my first job where I met my friend Jamie. I was like, dude, this is it. I'm gonna hang my hat here. I'll climb up the corporate ladder. I was like, I know how to work hard. I know how to say yes. I'll show up to like stupid events,
Same.
mingle with people, and then like after that, I was like, man, this sucks. But I didn't quit right then and there. I still like ate shit for like a year and a half.
Right.
But I asked to be in a really busy clinic with a lot of exposure to like high level athletes, just
Yeah.
because I knew if I want to fall, I rather fall like flat on my face first day all the way to the first year, and then from there I'm like, all right, then I can go elsewhere, right? So how was that for you? Because obviously you love what you do. Like, why do you like being a PT, and how did that passion for being a therapist drive where you are right now as a business owner?
Yeah, I mean, literally, I was really drawn to physical therapy, you know, coming out of college. It's something that I resonated with. I was really big on the educational aspect of it, where the profession was going.
Mm-hmm.
When I started out, like in my first outpatient job, it was kind of the same deal. It's like, sometimes you're seeing like 60, 70 people a day that you're making contact with, and, constant grind of that. See, I love that. I mean, like, I don't love that setting per se of like that volume, but I just love the fact that like, that you're able to do what we do and help people how we help people. And it's so, I feel, underrated. I don't feel we do a very good job as a profession of promoting that. And, when you're really, I think probably one of the things we can really agree on is like the disparity in quality of care and treatment.
Yep.
I mean, sometimes I'll tell people, like, I feel like I'm in a different profession than what I see everywhere else. And the level of knowledge that we have at our clinic and how we practice, it comes back to why we called it physiotherapy. Like, literally in our community, we wanted to differentiate ourselves from other physical therapy because I think the quality of care was so poor, we did not want to be associated with that. So physiotherapy opened up the conversation for people to ask, so what do you guys do? Right. So, it was actually funny. Like, one year I got nominated for best chiropractor in the area. Like, people would be going to their doctors and they'd be like, look, like, physical therapy didn't work for me. I need to go to physiotherapy, like stuff like that. And that was like the purpose behind the name, from the start.
Someone's like, is there a British guy here or like an Australian guy in Hermitage?
Hey, nobody knew what it was. And I was totally cool with that. I was like, because I don't want to be associated with what physical therapy is normally associated with, because we're doing something totally different. And, we wanted to open that conversation for people to start to talk about it.
So let's talk about this. Branding aspect, right? Physiotherapy. So clearly it's physical therapy. But to your standard, what should physical therapy look like?
I don't know that there's a right or wrong answer to that.
But based on the Anthony Roscoe way.
On how I practice, we're extremely hands-on. We're very knowledge and education focused. We do a lot of manual therapy. Not to say that you have to do a lot of manual therapy. It's a part of the way that we practice. I feel like there's a lot of benefit in just having the hands-on approach to people and building therapeutic alliance, getting a person to trust you, helping them to get comfortable with their own bodies. A ton of cueing, and just, again, a ton of educational aspect. And we go through different phases. I think what's missing in a lot of places that we do differently is, most people, once pain's gone, they stop physical therapy, right? It's like done. Okay, like, no more pain, like problem solved. And as we know, problem is not solved at that point. So our last phase of plan of care is retraining functional movements, squats, deadlifts, pulls, presses, all that type of stuff that, people are having to go back to in everyday life and just not realizing it.
So you mean train the things that they should be doing in the first place?
Right.
Is that why they didn't need the PT, right? So, let's go back to the branding problem that physical therapy has as a profession is that, is something that people don't seek out. People don't wake up in the morning and say, man, I'm going to go get PT.
Because what is it?
This is great. Yeah.
And literally, it looks so different everywhere you go.
Yeah.
If you go a quarter mile down the street from us, a person may never touch you. It may be put you on two machines, put you on a bike, and you're out of there.
Yeah.
And then they can come to my clinic, and it's a totally different experience. How do you communicate that to people? And that's where I feel like the profession did the right thing for whatever their reasoning was in transitioning to the doctorate. The doctorate level is extremely important for our profession. Yes. I think we need to take it up another level.
Yeah.
Still with that and responsibility that we can have.
Yeah.
But there's still like this weird gray area happening right now where people are still practicing very old school. And then there's all these other clinicians that are coming out and they're very progressive. They're using, different style, different technique in that. And then it's like, well, how do you define that under the same umbrella,
Yeah. No, I guess there's more than one way to skin the cat, right? And I think what it goes down to is us as a profession, we need to start looking at PT or treating patients more than just the pain, the symptom. What I tell my staff is like, we're in a transformation business. Like we get people from point A to point B, and then it's not done at point B. We got them to point C. Because the B is where they want to be, but the C is where they really need to be. Because that's where they don't see themselves, right? So it's almost like seeing their true potential before they can see it. If you can do that, then you can really brand PT the way it should be. Like, because that's how I see it.
Yeah.
Right? So, because if I come to you and if I can't deadlift, you're going to tell And the first thing I do, like, and I deadlift, like whatever, 135 pounds, you'd be like, nah, man, you're pretty jacked. I assume you would say that about me. You can probably do like 405, right? Because but then you give me that permission to go, because my point B was to be able to deadlift, right? But the point C would be 405. Like, just give them that permission, give them that, that guidance, that support. Like, no, I got your back, like literally, physically, figuratively, whatever it is. And that's what we're trying to do with literally all our patients. And then that's why I think it's coming back. And, I'm like super grateful, and I take pride in that, because we're able to do those things, to be able to see their potential. And, I'm sure like the way you practice the same way, like obviously you take good care of yourself, and every time, like just your staff, the way you guys approach things, just being around you for 2 years, I know that your patient definitely walking out a whole new different human than they did walk in.
Yeah, 100%. And you have to be extremely passionate about what you're doing to be able to sell that to a person and to get them to buy into that.
Yeah,
for sure. Because, let's face it, like that's a difficult conversation to sell a person on, as far as deadlifting, squatting, and all that stuff, and how that translates in everything else they're doing.
Yeah.
So I think that's where the passion in what you do really has to be there. You have to really believe in what you do, which is probably one of the big things you see missing in physical therapy right now, is people that are passionate about it, that really believe in it. That conversation too, it's probably because they've operated a certain way or practiced a certain way and haven't seen the outcomes, haven't seen the results, or, again, haven't seen it in themselves, and how they represent themselves, too. But that has to be something that, like, you have to transfer that energy over to that patient for them to see and understand and buy into that. And then that's when the transformation, that's when the magic is going to happen.
Yeah. I think just to go back to what you said before about us becoming, getting a doctorate in our profession, I think it's both good and also bad, because with a doctorate now comes with some sort of ego.
100%.
Right? Because now you have this thing like, I know better than you, and now it's never about the patient experience. It's more about my experience as a clinician to overimpose on the patient, to say, no, I know better than you. Why don't you just listen to me?
Yeah.
And, and then from there, I think there's a huge miscommunication, or like a disconnect, where we're no longer there to serve the patient, right? The reason we have a job in the first place is not because a company offers us a job. It's because there's a need. The need is that there's a lot of people in pain, and they need to get help. And in order to help them, you have to serve them. But now I think people are seeing like, oh, people are coming in. Oh, God, now they're impeding on my day. Let me put my doctorate hat on and let me help them. Let me just big league them real quick because I have a doctorate. So what are your thoughts on that?
I feel like your degree doesn't make you a doctor. Your patients will tell you if you're a doctor.
Yeah.
For sure, 100%. That's, like everyone has their own attachment to titles and that stuff. I think the educational aspect of it is great. The title, it doesn't matter to me.
Yeah.
I have detachment from that to say, like, you'll notice a lot of people will call you that when they respect you.
Yeah.
When they respect your opinion, when they really feel like that you help them. But again, I don't think, like, a lot of times people look at that as the terminal endpoint when you get that degree and that license, and it says that, you have a doctorate in this.
Yeah.
And that's only the beginning. That doctorate is not earned through school. That doctorate is earned through practice.
Yeah.
As it should be.
It's like demanding respect. Like, you should respect me. Like, no, it's earned.
Right. And let's be honest too. That's weak. Like, it's weak for people like to come in with that and say, like you said, like, you're gonna communicate with the patient in a certain way because you're a doctor. Like, what?
Yeah.
Like, I don't care if you're an MD, you're a DO, you're an orthopedic surgeon, whatever. Like, people that operate in that manner from the ego standpoint, it's not going to get you anywhere in life. It's not going to get you where you want to go. You know?
So let's just talk. All right. Obviously, you own your own business, doing really well. But the one thing we never talked about was the only time we talk about financial stuff was you paying off debt, right? But not once did you mention, say, I got into this because I want to make money.
Yeah.
I got into this because I want to, buy a Lamborghini yacht and all this. And
just more Mercedes.
More Mercedes, exactly, right? So let's talk about, how you build your practice. Obviously, you're super passionate what you do, and you care about your patient well-being. So let's talk about how that, that passion you have led you into the direction where you are right now with your business. Because I feel like people now coming out of school, they're like, oh no, I'm just going to start my own business. I'm just trying to make bank. But then for me, it's like the reason I am where I am right now is because the investment I did as far as my clinical outcome, how much I care for my patient, right? Because it's a great referral source for me. And because I'm pretty good at what I do and I'm always learning, I can spot when I need to hire someone, and that happened to be a great therapist.
Yeah.
Right. So hold on. I think we might lose this one. Are we on? Shit. Yes, we're good. Go.
Good. Yeah, I mean, you have to. It's like sports. I always think like you have to want to be the absolute best at what you do.
Yes.
You know, I mean, I think that translates into at least one of the foundational aspects of having a successful clinic. You know, when you go out on your own, whatever path you need to take to get there. You know, I always think about like my timeline in that, and you know how successful we were in such a short period of time. We never really had any period in the last 5 years where we haven't been experiencing tremendous growth, you know, in our clinic. And I really laid that foundation solid within our community for the first 6 years that I was in practice, you know, working for other people. And again, sometimes you're like, oh, like I wish I would have started this sooner, but that man, that's not my journey. You know, my journey was what it was, and I learned so much from the good. I learned even more from the bad situations I was in. You know, but never once in that period of time did I not want to be the absolute best at what I did.
Yeah.
And not even from the ego standpoint, but you feel like you mentioned from the service aspect, that you want to be able to give that and deliver that to people. You know, people are coming in, and whether they're paying co-pays or cash or they're spending their time with you, you want to make sure that you're doing the absolute best that you can possibly do for them. Like our business core value number one is do the right thing for people.
Yeah.
You know, period. Do the right thing. You know, when you do the right thing for people, money follows, success follows, you know, all the good things that I think people are attracted to initially for business and things like that. That can't be the focus to get that. That's just it's a secondary outcome to really being focused on being passionate about what you do and serving people and helping them to get the outcome that they're looking for.
Yeah, I mean, the biggest thing for me was establishing some sort of credibility to say like, hey, I am the ACL guy, I am the sport guy, right? And you don't get that by just saying like, hey, I'm the sport guy. Like, call me that way.
You just announce it on Instagram
that's
when
my
you're there.
thing. Like, I'm the sport guy. Please call me that. Like, it's not like that. And it's always just about just serving the people right in front of you. And going back to the copay things, like, and this just kind of dawned on me that whenever I treat, whether I was working for someone or not, or working for myself, and, you know, as I was working myself, like my price point changes as I'm more seasoned, I have more to provide, right? But the one thing I always focus on is not what they pay, but the amount of time they spend with me and what I accomplish in that time. Because I have more respect for people's time rather than their money.
Yeah.
You know, my concept of money has always been like, you know, if you live long, you'll make more money. Like, you know, the longer you live, the more you make. Like, it's really easy. Just don't die too soon.
Yeah.
But the time, you can't get that back, because that time that the patient choose to drive 20 minutes to come spend with me, and then they could have been doing anything else. And for me, like, I owe them that. It always been the thing. Like, and I owe them that to get really good at what I do in my craft.
Yeah, I mean, when you make the choice actively to take on that patient, you owe them that, no matter the situation. You know, I feel. I mean, especially like you being the guy in ACL recovery and rehab. I mean, talk about like a time thing. You know, what's the average recovery from an ACL versus what you're seeing out in your clinic?
10 to 12 months. Yeah.
Right. And what are you seeing?
Yeah. No, I mean, I'm seeing them nonstop. Like, I mean, literally, it's my second family. Like, you know, like, at some point when I have like a ranch, I'll probably invite all the athletes to come in for like Thanksgiving dinner, right? I mean, but it's a relationship thing.
Yeah.
You know, I mean, I got invited to weddings, like all these things. Like, it's
right, and that's
incredible.
That's a testament to success. You know, and again, it's like the money's secondary to that. The money's going to come. Like, it's going to be fine. Like, all that's going to be there. If you set up those foundational points within your business that you're influencing people that much, that you're getting invited to weddings, I mean, it happens all the time, you know?
Yeah.
And that's because you're building relationships with people and they actually care about you. And you're helping them too, you know, which I think is the most awesome thing about it all.
Yeah. So, you know, just obviously fast forward to where you are now, you know, building the relationship in the community. How did you go about that? Because obviously when people come out, they want to establish something for themselves. They want to establish. They want to be that person in their town. How do you tell people to be that person? How do you go about
You
it?
got to, well, number one, you got to be that person.
Yeah.
Right? Like,
Yeah. Not demand it, right?
No, like you actually got to give a shit about people.
Yeah.
You know, for real. Like you have to be that person. You have to be that person 24/7. You got to be a representation of your brand all the time.
Yeah.
You know, I was a representation of my brand before I had a brand. I just didn't realize it. You know, but that's who I was. And I was comfortable doing that. That's who I wanted to be. I mean, I still ask myself the question every day, who do you want to be? I mean, I think that's such an insightful and important thing to ask yourself, because it changes by the day. You know, foundationally not, but sometimes other aspects of that will change. And I think it's a very good grounding question to remind yourself of who you are, and to stay focused on that. But I mean, when it comes to like building relationships and community and that, I mean, it takes time.
Yeah.
You don't just show up, you know, again with like your certificate or your license or you know, your diploma or whatever, and it's like, here I am now, everybody come rush to see me. Like, if that's the attitude for people like coming out of school, coming into business, they're gonna be very disappointed in the outcomes that they're seeing. You know, and I mean, that's a huge reason why our clinic has been so successful, is our ability to actually care about people and to build relationships with people. I mean, that's like the magic sauce in everything that we do. You know, people always hit me up and ask me questions like, what do you do for marketing? Like, how have you been successful doing this? What's your sales process like? And it's like, literally, like, we just like, we're very, very good at like caring about people and building relationships, because it's just legitimately true. Like, it's who we are.
Yeah. No, I mean, I get DMs and all this stuff. Oh, you know, I want to start a clinic like you. I want to do this and that. And my simple question is like, then you gotta know people. You gotta meet people. People gotta know who you are. It's not about, you know, like, we both have beautiful clinic, right? But we didn't have the backing of our community, the people that we helped in the past. That was not going to happen. Like, you and I have built from the ground up. I mean, we didn't take out loans. I mean, I maxed out my credit card, you know, just to get it going. New Jersey is a little bit more expensive.
It's a little pricey.
Yeah, exactly. But I'll tell you what, with your clinic, man, I mean, I would apply for a job. It's nice. It's beautiful.
Yeah, I mean, that's the goal. I mean, you want to create a space that not only is there for patients, but for, you know, employees too.
Yeah.
I mean, I think about like why I got out of being a staff PT. Like, I was going to leave the profession. You know,
okay, yeah. So let's go into that a little bit. Yeah.
I mean, I was done. Like, literally, it was probably like pretty close to like 5 years to the day where I came down here when Greg Todd had the initial, like, it was like the second SSPT live, I think, and we sat in on a mastermind with Paul. That's when I first met Paul, you know, and Aaron LeBauer, and that was kind of when I made the choice to go into business, where I was going to go back to school to be a DO. You know, that's where I was at. I just was.
You're like, Harry, pay off this loan. I want more loans. So
right.
It was work harder, you know, to pay off.
It was such an emotional decision at the time. You know, I was just looking for an out. You know, I was tired. I was, you know, my workload was getting higher and higher. I was seeing a lot of patients, and it wasn't necessarily like, it wasn't the volume or the grind that got to me. But I think, like, even I was working in skilled nursing full time by that point. There's a lot of different, like, moral and ethical positions that you get put in that you don't feel comfortable with. And that's where I was at, where I really felt like sometimes I just couldn't win and I couldn't feel good about what I was doing.
Yeah.
You know, so I knew that I needed to make a change in life. And I said it was either going to be go a different professional route in healthcare, or it was going to be start the business. And I'm very, very glad that I decided to start the business. But again, the business wouldn't have been as successful as it's become without that other experience happening prior to it.
So for 6 years, you worked 3 jobs. And after 6 years, you say, man, I'm really burned out. So for all the new grad listening that are working 1 job, seeing 3 patients an hour, I think the bar is set pretty high by you.
Yeah, I mean, that's, again, like, I hear that and it's like, I don't want to hear it, you know?
Yeah.
Like, and I mean, even in my situation with like the burnout aspect, it was like, it wasn't the burnout from the grind from the work. It was never that.
Yeah.
You know, I could work as many hours as I possibly needed to work. Like, I love doing that. Like, I love grinding.
Yeah.
You know, I'm okay saying that. Like, I know, like, now we talk a lot about it. And it's like, oh, we need to move away from this mindset. That, like, I'm always going to love the grind of certain things. Like, sometimes even now, like, I'll work till 11 o'clock at night. You know, I just, you know, not all the time. You know, but sometimes, you know, I just really like doing that and feeling accomplished in doing that.
Yeah.
It was more on that other end where I felt like this is just getting a little bit outside of my control of what I feel comfortable with. And there was a lot of pressure, I think, internally, you know, and maybe it's a very generalized example of what you'll see in skilled nursing
Mm-hmm.
is you have a patient that comes in and, they're passing away, in the
Mm-hmm.
next 24 to 48 hours, and you get them on your schedule and they have 53 minutes of therapy. And it's just like, I mean,
Gate
it's
training.
right. It's like, and you're like, I don't feel that this is appropriate. Well, you
Yeah.
need to get the minutes. Well,
Yeah.
like you start to see things like that in situations, and that's where I think it really started to make me look differently, at the profession, and I knew that I needed to be the change within that.
Mm-hmm.
If I was going to see a different situation for myself, I had to be the person to make it. I couldn't rely on someone else to make it for me.
Yeah, and I have to agree with you, man. Just hearing you talk and going back to like my first job was still seeing 3 an hour and just getting home at like whatever 9, eat dinner late, do notes, got to be done before 12, and I was burned out. But the only thing that kept me going back was the patient, the outcome,
Yeah.
all the things that I was getting, like helping them, getting them to where they need to be, seeing where they are from day one to now. Like that was like what I was there for. And
Yeah.
we have this thing in my clinic where, my media guy would know this. Like every time I hire someone, like, what do you want me to do? I was like, dude, I want you to capture one moment for me. This is the moment I live for as a PT. It's when a switch goes in their head that's like, oh my God, so I can do this.
Yeah.
I was like, yes, capture that I can do that moment. And that's all I live for. I was like, every day. And, like I don't treat as much anymore, but when I do, that's what that just keep me going every single time.
Yeah,
like
you've created a business now that like enables other people to do that.
Yeah.
Which, I mean, sometimes I sit back and I'm just like, I'm in awe of like what's happening around me.
Yeah.
I'm like, you're having like this direct and indirect influence on all these people and how you've like created these systems and these teams that are able to help them and bring them that outcome. And like you'll get like all the emails pouring in about how well people are doing, how thankful they are, and all like just the gifts and cards and that stuff that you get, and you're just like, wow, this is like really amazing.
Yeah.
That like you just have this passion, this fire for something, and you're able then to build this and be a part of that.
Yeah.
Even without you having to put your hands on patients.
Yeah. No, I mean, we're talking about impact scale. Like I know, like with 2 hands, this is how much I got.
Right.
If I hire people, train them, and then again, like my passion for the field is what feed down into my employees, who is not even PT. Like my front desk staff, all that. They know, like listen, you can help these people by just the way you answer the phone call. Like they're not in a good place when they call you.
Right.
So like it's your job to make their day, right? Because you can still help people.
Yeah.
Like like without being a PT. But I think like it's our drive, our passion really dictate how other staff are representing themselves and helping the patient that's stepping into the door.
Yeah, you got to be the leader. You got to set the standard.
Yeah.
Right. I mean, you have to be the example.
Yeah, and another thing I love too is that you said, yeah, I love grinding. I still work till 11. Like sometimes I do that because it's a gut check. Like, do I still have it?
Right.
Like, oh shit, I still got it. I can still do this. Yeah.
Dude, I mean, why wouldn't you want to do that?
Yeah.
Like, I mean, again, it's like that shouldn't be the end goal. That like, and it's not. I'm not doing it because I have to do it to survive in the business. Sometimes you just want to put your foot on the gas, and you just want to push a little harder.
Yeah.
And you know that you can expedite the process to do that if you put in the work.
But it's going back to the foundation, right? So.
Oh yeah.
So the shit years, those are your foundation years.
The best years.
Because it give you that ability to go back, like, oh, I did that. Like, this is nothing.
Yeah.
Like, it's so I'm super grateful to those, those earlier years, right? Just because it gave me so much insight, what I'm able to do. Like I got so much better at like, correcting, cueing thorax, and I'll tell you what I did really well was I started investing myself more. I'd say, okay, if I'm going to see 3 patients an hour, right, that's one of me, so I should learn as much as possible so I can assess quicker, I can give better cue, I can get better outcome. And that's all I did. Like, so like right now, obviously you and I are here for a business conference, we're always investing in our growth business-wise, but when I look back, I always invest in my growth, but it's always started clinically first.
Yeah.
And I was like, oh, now I just stop spending money clinically to now business.
Yeah, and I mean, even just like being resourceful.
Yeah.
Like looking at that situation, being resourceful, and instead of like most people would complain about the situation, oh, it's too much, I can't see this patient. Like you looked at it differently, and you said, I'm going to come in here and I'm going to get better at what I'm doing, so I can get faster, so I can help them faster, so I can be more present with them, right? you used it as a growth opportunity instead of an excuse to fail.
Yeah.
You know, which most people would use that as an excuse to fail.
Yeah.
You know, but again, it's like if you don't have that internally, it doesn't mean that you can't get it, but if you're going to go into business, you're going to have to get it.
Yeah.
You know, there's no way to expedite that process of turning into the person that you need to be. That's probably like the main thing is like, if you ain't the guy, if you ain't that guy, like it's going to catch up to you eventually. And it's just like we're doing here. Like you said, you know, we're going to these conferences, we're traveling a lot. We're always trying to expedite our personal growth, our personal development. And without that, what happens?
Yeah.
Right. You get left behind, you know, and it's a slow death in business.
Yep.
You know, honestly, like you can be rolling and grinding, and then one day it's just like, what's going on? Like, what's happening? You know, you're either moving forward or you're going backwards.
Yeah.
There's no like staying still in business.
Yeah, it's a slow moving forward, but it's a fast
deceleration.
Deceleration. Down the hill,
which is cool.
Yeah,
you know,
you just gotta keep keep the gas going.
I like that pressure. You know, I enjoy that aspect of it. Again, I feel like you have to have a little bit of that. I definitely feel like over the years of being in business, like you hone that skill a little bit more. You strengthen that muscle and being comfortable with that.
Yeah.
You know, a little bit of volatility, you know, which personally coming into that, I probably had very minimal amounts of tolerance of risk and volatility, you know, based upon like, I literally had like a 6-figure bank account, you know, of savings from working like staff PT jobs and being like, okay, like, is it okay? Like that was like my question, like to Paul, when I did the mastermind, like kind of like, am I okay to do this?
Yeah.
And everyone was like, looking around like, what the fuck?
Yeah.
Like,
no, we saw your balance sheets. We're like, yeah, dude.
We're like,
let me do it for you.
But then, I was like, you know, spend this, do that. And Paul's like, walk out of here today and forget you have any of that money and try to operate and start your clinic from the standpoint that you have nothing.
Yeah.
You know, which I did, you know, and again, it's that same deal of like working from the grind, minimizing expenses. I think we had initial like investment of like $30,000 to $40,000 and that was it.
Yeah.
That's all I needed.
Yeah. Yeah. I mean, these are like really awesome points, man, because it's all parallels, right? And then again, just going back, like for the PT student or like other PTs that are listening to this, like, you know, it was also know your strength. Like if you don't want to be the guy, you don't have to, right? I mean, how about you just work for the clinic? Like I like to say, my clinic is the clinic in New Jersey. Roscoe Physiotherapy is the clinic in Hermitage, right?
Yeah.
And then it's going to be PA soon. So I think being honest is another thing too, right? Like just be honest with yourself, like, and say like, hey, maybe I like to dabble in working with this kind of active population, this and that, and I want to learn from like someone like me, someone like you, like, and obviously like back then, I'm sure my clinic was like one of the first one that does one-on-one, do all return to play stuff. Your clinic is probably one of the few and far between around that area.
Yes.
And the reason I'm sure we both started was these are options we didn't have.
Right.
If we have these options, you and I wouldn't be in Clearwater right now.
Yeah.
Right? We'll be just working for someone. We'll be pretty happy.
Yeah.
Yeah.
And I mean, you know, again, like we went out and like created the professional life and personal life that we were looking for. I would very much encourage people to seek that out, maybe even first. And that could be a terminal point for people too. You know, again, it's like business ownership is not for everybody. No. You know, I mean, the stats, 96% fail in 5 years?
Yeah. I mean,
that's like behind the 4% club. It's like, you know, like at that 5-year point, 96% of businesses have closed.
Yep.
There's a reason for that, you know, because it's like, if you feel burnt out now as a staff therapist, like you're going to feel like 10 times more burnt out as a business owner, you know, when you start out like that. So, I mean, I think there's like that aspect of it and looking for opportunity, where maybe like you can find middle ground for that. You know, I know like our clinic, like we're starting to develop roles for people to come in that they can have some stake in profit sharing and have more management / ownership of what's happening with, you know, metrics and KPIs at the clinic, but not quite going to that standpoint of having the risk of being a full-fledged business owner and, you know, sometimes literally mortgaging your home or, like you said, maxing out your credit cards to be able to even get to the starting line of that. So not having as much risk, but having a little bit more responsibility and then being able to share in some of the success with that.
Yeah. No, I love it. I love how you're getting creative to help your staff grow. And I'm always thinking, one of the reasons we started this podcast is to kind of just really light the fire to be like, hey man, it's pretty still badass to be a PT, but if you find the right company to work for with the right leadership, you'll have room to grow. Because like I'm always thinking like, how do I treat my staff? What's the next growth opportunity for them, right? And that's the whole point, because that's something I wish I had.
Yeah.
Right? If I had that, if someone's to be like, yo, Natty, come work for me, you get to see your main population. Oh, guess what? There's a content course you can teach. You'll make extra money. Oh, you want to buy a house? Here's extra shift you can do. I'm like, damn, that's good.
Right.
But
because you care about people.
Yeah.
I mean, like caring about people doesn't stop at the patient end. Like you care about employees, you care about future employees. Like you just care about people. When you have that mindset and attitude, like you want to set up positions for success for people.
Yeah.
Like that's probably one of the most rewarding things that you see in business is like the personal growth of your employees, personal and professional growth. And like you being able to create a system in a business that gives them opportunity to see success that they would never see anywhere else.
Mm-hmm.
I mean, how cool is that?
Yeah.
Like just the opportunity to be able to do that, let alone to pull it off. And that if you recruit well and you have the right type of person to be able to just see them, come up through the ranks and become, something that probably they didn't even realize that they can become.
Mm-hmm.
Yeah. I mean, our one of our PTs now, she just graduated about a month ago.
Mm-hmm.
She's been with us for the last 4 years. She started as a shadow student.
Wow.
And she'd be rolling into head PT, position in the next 90 days and, possibly clinical director.
Wow.
From that point, I mean, so just that opportunity to see a person grow from literally like the fledgling start, just showing up because they're interested in that. And then seeing the person they become through that process because, you care about the opportunity of other people. I would say more than you care about for yourself.
Yeah. And I think I have to touch on this point before we finish up is that phrase just showing up. Like she showed up to shadow.
Yep.
And that's why she is where she is now, right? I think there's a lack of people showing up now. Like I used to just show up at like whatever, like my professor's like, hey, can I just show up and hang with you for like 5 hours so I can learn from you? I mean, my main PT, Matt, he's been with me since day one. He was a student at my first job, and he would just say, hey, and he wasn't even my student. He was just like, hey, man, I know you're doing this ACL stuff. After the shift I do with my CI, can I just come hang with you? I'm like, hell yeah, come help me. Yeah. And then 2 years later, he did residency, got his OCA, pop his head back in. He's like, hey, man, I'm back home, this and that. I just go, bro, you need a job.
Yeah, right.
And like now he's been with me. I just met with him like before we came here. We both took off to Europe the same time for 2 weeks. And we had this all moment where like, dude, like 2 years ago, it was just me and you grinding nonstop. Now we're like, the fact we didn't go together, but we went different time. The fact that we're able to take off together because we trained great PT, credit to him because he really helped with educating them. And they were able to hold down the clinic and taking care of the patient. When we both came back, it wasn't like, thank God you guys are back. So-and-so wasn't good.
You roll back and everything's going smooth. You're like, oh, okay.
This is great.
Right?
So to me, like, I'm super grateful. But it's all about showing up.
Yeah.
Like,
well, I mean, you know how it is nowadays. Like, people want to be paid for everything.
Yeah.
But you don't understand that, like, showing up is an investment in your future.
Mm-hmm.
Like, I would look at, like, my advice to people, like, coming out of school right now, people that are in school right now, I'd be volunteering so much of my time for free, just getting in front of people that have accomplished something that can be good mentors and building relationships there. Because again, it's like you might not be making your minimum wage that you want to make as a tech somewhere, but what's the exponential growth factor in that time that you're spending, and what's that worth 5 years from now, 10 years from now?
Yeah.
And how that helps you to expedite your personal growth, how it helps you to make better decisions moving forward. And I mean, all that, like, people just look at that stuff all wrong.
Yeah.
And you said you just got to show up.
Yeah.
Really show up, be ready to learn. You might learn things that you knew already.
Yeah.
And you might learn stuff that you didn't realize, about the profession too.
Yeah. But it's kind of crazy to think that you just finished school and you feel like that you already know everything already. So I think that's a good mindset to approach. Like, just be a student forever, right? Yeah. Just like you and I are. We're always a student, and also like reaching out to people via DM does not count as
No.
shadowing or showing up
No,
at all.
There has to be action.
Yeah.
There has to be time spent.
Yeah.
Yeah, you have to actually physically do something.
Yeah.
It's not just going to be people sometimes DM and feel like that they're like accomplishing something from doing that,
Uh-huh.
but again, I always say, like, my line is, you're responsible for the outcome of your life. At
Great.
the end of the day, like, period, that's what it is. So if you put forth enough effort, enough work to get to the outcome that you're looking for, you're going to get there. If you didn't, it's going to show.
Mm-hmm.
So I mean, if that's what you want to do, that's fine. But 5 years from now, you're stuck with that outcome of whatever work you put in, prior to that.
Yeah, I don't think I need to add anything after that, man. I think we should just end it right there. You dropped the bomb right there. You're responsible for your own outcome. So before we go, where can people reach out? Where can they apply for a job? How about that?
RoscoePhysio.com. So RoscoePhysio.com.
And on your social?
Yeah, with social, Roscoe Physio on Instagram. Same spelling. We're always looking for people that want to come up, that want to intern, that want to be, really any sort of position that wants to fast track and understanding, learning about business more. We're a hybrid clinic, so we really have a deeper understanding of even like billing and both like cash pay and insurance based, practice. But, most importantly, we're looking for leaders that want to come into an organization, almost on the ground floor. We're a little bit above that right now, but have opportunity for growth as we start to scale and expand out to, the goal is multiple clinics, 5 clinics in the next 5 years, so always looking for people that want that opportunity, that are willing to work for it.
Love it, man. So, and thank you for your time, man.
Hey,
Appreciate
thank
it.
you. Appreciate it.
Yes. All right, guys. Make sure you check them out and go visit the clinic. It's damn beautiful.
Yeah, definitely.
So, thank you.